I'm Dr. Juyia. I'm from Elite Women's Care, where we practice gynecology only, and today we're going to be talking about contraception.
What are the different birth control methods?
In the United States, the actual most common method of preventing pregnancy is a tubal ligation, which is permanent and surgical. Everything else is not surgical, and some of these options are even as effective as having your tubes tied, and those would be the IUDs, which are becoming increasingly more common, the Nexplanon, which is an implant in your arm, which is also gaining popularity because it's so easy, and then there's the ones that most people already know about, like the birth control pill, and there's also patches, NuvaRings, and the Depo shot every 3 months.
When should I consider long-acting birth control?
A long-acting birth control, which would be a Nexplanon, which is an implant in the arm, or an IUD. There's many types, but they are a little T-shaped device that goes in the uterus. These should be considered if a patient knows that they don't want a baby for the next year or longer.
What birth control options are non-hormonal?
There are many non-hormonal options on the market for whatever reason a person might be desiring to avoid hormones. These include the barrier methods that most people have heard of, like condoms, female condoms, diaphragms. There's a new vaginal insert gel on the market that's about as effective as all of these. There's also an IUD that has no hormone, and this is over 99% effective for a decade, actually. And this is as effective contraception as having your tubes tied, which is surgical disruption of the fallopian tube, and this is also non-hormonal.
Do I need to be 18 to get a birth control prescription?
A person does not have to be 18 years old to seek birth control. Actually, this is something that can be prescribed for any person that's desiring to avoid pregnancy.
What are the common side effects from birth control?
Of course, there's risks and benefits to any sort of medication that could be possible. Generally, when there's an estrogen-containing contraception, there is an incredibly rare risk of blood clot that is still many times less than the risk of this in pregnancy. And so for most people, this is not something that they actually encounter. If a person does have something that's changed and they don't like it, like a side effect from birth control, there's usually another option that does well for that person to try.
Does birth control cause weight gain?
I get asked a lot regarding side effects if birth control causes weight gain. Birth control does not cause weight gain, and we've proven this pretty thoroughly for all types. It has no calories. However, some people might feel hungrier if they're very sensitive to certain ingredients, in which case we can usually avoid that situation.